In our study, we aimed to recruit 10 people with treatment-resistant epilepsy and with frequent seizures, still as reported by their diaries. And we implanted them with the subcutaneous EEG device. So this was a unilateral three contact, so 2-channel EEG device. And we placed the device under the skin in the area where, after looking through the patient's previous investigations, it was deemed where the seizures would be more easily detected. And so after implantation, patients started recording 2 weeks later. And they were also asked to fill out an electronic diary to log their own reported events, and to also use a fitness tracker, a Fitbit, throughout the duration of the study. And throughout the study, we collected safety aspects, acceptability aspects. So patients were asked to fill out acceptability questionnaires in the middle of the study and at the end. Patients were asked to record, so connect the device as much as they could during the day and during the night. And roughly monthly, we would contact patients and see whether the recordings were being done correctly, whether there were any issues or technical issues, and so forth. And so this lasts for up to 15 months if the patients accepted to do it. And then after the 15 months, patients were explanted and in the study. So what our study showed is that, first of all, patients were able to record a large, for a very long time and very regularly. So on average, patients were able to record about 19 hours per day of subcutaneous EEG, and for up to 15 months. So in total, we collected about close to 72,000 hours of subcutaneous EEG. So this is a very large amount of data. And then we took these data and we applied a seizure detection algorithm so that we could reduce the amount of data that we were then would have to review manually to look for the seizures and to identify the seizures. And so at the end, we ended up with over 750 seizures recorded from the device, compared to a lower number of diary events. What we also found was that over 50% of the EEG seizures that we recorded did not have a diary report close to the time of the seizure. So clearly we recorded more seizures than the patients were reporting. In some cases, we also recorded clonic seizures, so convulsive seizures that patients did not report. So this clearly has advantages over a patient's diary, and we might be able to have more objective information about their disease over time. Of course, this is a small-scale study, so we only included 10 patients, and so there's a clear need for larger-scale, multicenter studies that are and one of them is actually ongoing in our center and across the UK at the moment. So this is a multi-center study led by our lab at King's College London, King's College Hospital, involving 3 to 4 centers across the UK, where we will aim to recruit 33 patients, I believe, 33 patients with drug-resistant epilepsy as well. So patients will be implanted with a device, and then it will record for 6 months. Now, this will be a interventional study, so a prospective interventional studies, where patients will be given feedback about their seizures on a monthly basis after the technical team and the research team and the clinical team reviews the data. So every month we will discuss with the patients how many seizures they had, how well this compares with their own diary, and whether we make any treatment decision and treatment changes compared every month. We will also look at overall the acceptability by patients and also the acceptability of this technology in a real-world environment in the NHS. And we will also, at the end, look at cost effectiveness of this technology. So we'll compare the costs of using the technology to potentially saving, for example, hospital admissions, unwanted hospital admissions, or due to, for example, side effects or excessive seizures or status epilepticus.